WHO and Africa CDC have finally put a number on it, a $518 million joint continental plan. And it lands the same week WHO declared this outbreak a public health emergency of international concern.
This is Ebola Watch. And Sarah, that's the dollar figure I've been waiting on all week. But $518 million in a press release and a burial kit on a truck in Bunia are running on very different clocks.
They are. So today, we're holding the new structures to what they actually promised: the PHEIC, the joint plan, the EAC measures.
And Africa CDC flagged something almost nobody's leading with. A treatment facility was attacked and destroyed. We'll get there.
Let's start with what's physically moving on the ground: the IFRC shipment into Ituri. IFRC delivered 13 safe and dignified burial kits to Bunia. That's the Ituri provincial capital, and Ituri is carrying 94% of confirmed infections. Those SDB kits interrupt transmission directly.
Okay, the EAC ministers. New screening, more lab capacity, a task force. Sarah, Africa CDC called for an urgent meeting May 15th. Is this what that call finally produced, 3 weeks later?
It's the first concrete regional output, yes. But look at the calendar. The EAC measures and the Africa CDC WHO continental plan landed on the same day. Two multilateral structures unveiling coordination frameworks at once. And the hardest new detail, Africa CDC reports a treatment facility was attacked and destroyed. That's the first infrastructure loss of this outbreak.
Dr. Sibushishi said this outbreak was outpacing the response. Does the plan's scope actually match that pace, or is it catching up to last week?
The institutions finally moved at scale. I'll credit that. Now the test is whether $518 million and a continental plan can outrun a response that was already losing ground. Here's World Health Organization.
The Africa Centers for Disease Control and Prevention, Africa CDC, and the World Health Organization, WHO, today launched a joint continental preparedness and response plan on the ongoing Ebola outbreak caused by the Bundibugyo virus. The plan aims to raise $518 million to support African countries together with partners to prepare for, rapidly detect, and respond to the outbreak.
Africa CDC and WHO put a number on it today: $518 million over 6 months, June through November, under one response framework. It's the concrete product of the coordination push we've been watching since that May 15th call.
So we went from case counts and trial talk to a $500 million continental plan. That's the escalation. But Sarah, does $518 million mean anything in Bunia today, or are we mostly looking at new letterhead?
Fair pressure. The plan names surveillance, lab testing, infection control, logistics, the right columns. But does that scope match the pace Dr. Sibushishi described when he said the outbreak was outpacing the response?
It also says it complements the DRC and Uganda national plans. So now we've got continental, regional EAC, and 2 national tracks. 3 weeks after the urgent call, the diagram's getting crowded.
CIDRAP, with Lisa Schnurring.
The World Health Organization has declared the ongoing outbreak of Bundibugyo Ebola virus in the Democratic Republic of Congo and Uganda a public health emergency of international concern, just 2 days after the outbreak was confirmed.
This is it. Who declared the Bundibugyo outbreak a public health emergency of international concern? The escalation we've been watching all week is official.
It is. And this same news cycle gives us the Africa CDC and WHO Joint Continental Response Plan, the concrete output of that May 15th coordination track Daniel's been asking about.
Okay, but here's where I keep landing. IFRC just shipped 13 safe and dignified burial kits to Bunia. Does the PHEIC change anything in Bunia today? Or does it mostly move paperwork in Geneva?
A declaration doesn't dig a grave. 13 SDB kits in Bunia is the kind of concrete transmission interruption tool that actually moves the curve, and Bunia is the Ituri capital, in the province carrying 94% of confirmed infections.
So measure it against burial demand, not the press conference. 13 kits for the province, doing most of the dying.
Right. And the sharpest new variable cuts the other way. Africa CDC is reporting a treatment facility was attacked and destroyed. That's isolation capacity gone in real time, the same week a plan promises to protect it.
A destroyed treatment site, on top of that 20% healthcare worker infection rate from June 4th. Kara, is facility security even inside the PHEIC's scope or completely outside it?
A PHEIC can unlock coordination and resources. It doesn't put guards on a building. That's where outpacing the response stops being rhetoric. A destroyed bed and a dose stuck in Geneva both leave care unavailable. IFRC writes.
This shipment was airlifted from Dubai to Entebbe, Uganda, and then departed for Bunia by road on 29 May 2026. It contained 13 SDB kits, supporting approximately 300 safe and dignified burials. The land route from Entebbe to Bunia takes approximately 7 days, underscoring the logistical complexity of reaching affected populations in this remote part of the country.
The concrete number today is 13 safe and dignified burial kits that landed in Bunia on June 3rd. IFRC says that supports roughly 300 safe burials. Bunia is the Ituri provincial capital, and Ituri is carrying about 94% of confirmed infections.
And look at that route. Airlift to Dubai to Entebbe, then road to Bunia. 7 days by land for the last leg. The kits left May 29th to arrive June 3rd.
That 7-day road segment tells you so much. A kit sitting in Entebbe doesn't help a burial team in Butembo. Same problem we keep circling, except now it's measured in days of truck travel.
So here's my question. WHO declared a PHEIC this same news cycle. Does that declaration help the second shipment sitting in Kinshasa, or is that still just a logistics problem?
The reopened airport probably matters more for that Kinshasa shipment than the declaration does. IFRC says with the airport open, the second batch arrives by air within the week. Logistics, not diplomacy. Here's Felix Kipkamoy at The Star.
The East African Community, EAC, has intensified its response to the ongoing Ebola outbreak, directing member states to harmonize screening measures at airports, ports, and land border crossings, while expanding laboratory capacity and refresher training for frontline health workers across the region.
EAC ministers met virtually for the 8th extraordinary meeting, and the output was harmonized screening at airports, ports, and land crossings, plus 10 mobile labs already running in DRC, Uganda, Kenya, Rwanda, Burundi, South Sudan, and Tanzania. 7 countries with kit on the ground.
And this lands the same day Africa CDC and WHO unveiled a joint continental response plan. So we've got a regional framework and a continental framework arriving in the same news cycle.
Right, and Africa CDC called for that urgent coordination meeting back on May 15th. Is this what that produced? 3 weeks later?
Partly. Coordination is good. I'm worried about whether these two frameworks share protocols, and whether the harmonized screening Kenya runs at its airport matches what Kinshasa runs at Bunagana. 10 mobile labs only help if they're reporting into the same system. Here's EU reporter.
Africa Centers for Disease Control and Prevention, Africa CDC, www.africacdc.org, is concerned about the recent attack and destruction of a treatment facility serving communities affected by the Bundibugyo virus disease in Ituri Province, Democratic Republic of the Congo. We strongly condemn all acts of violence against health facilities, healthcare workers, patients, and response teams working tirelessly to protect communities and contain the outbreak.
A treatment facility in Ituri was attacked and destroyed. That's today's news. The same week, WHO declares a PHEIC. Someone just took an isolation site off the board in the province carrying most of these cases.
And it's the first reported infrastructure loss of this outbreak. If a treatment facility is gone, confirmed case management capacity is gone with it. You can declare an emergency in Geneva, but you can't isolate a patient in a building that isn't there.
Right, so connect it for me. Last night we had that 20% healthcare worker infection figure from the International Medical Corps. Now a facility is the target?
Dr. Jean Kaseya's framing is the part I'd hold on to. Communities are not the enemy, and fear and mistrust are the barrier. That's Africa CDC naming the thing that destroyed the facility before they name any security plan, because they don't have one to announce yet.
So the honest answer to a worried family in Bunia is, the PHEIC may change the coordination picture, but it doesn't change the perimeter. facility security sits outside its scope?
Largely, yes. The Joint Continental Plan is supposed to protect physical capacity, and on the same day it's announced, physical capacity gets attacked. The plan is moving on one clock. The ground is moving on another.
If you listen to Ebola Watch for clear daily updates on fast-moving crises, try Iran War Daily, a daily foreign affairs briefing on the U.S.-Israel-Iran war, from strikes and ceasefire talks to oil markets and regional spillover. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. If something stood out, that's the place to follow it further and read the source material for yourself. That's Ebola Watch for today. Thanks for listening and take care. This is a Lantern podcast.